What treatments might a doctor recommend for fatigue?
That's a good question. I need to sort of, state that really the FDA hasn't approved any medications specifically to treat MS fatigue, but that hasn't stopped doctors from kind of getting creative and coming up with a few different things that can help, such as Provigil, Silert, amantadine. These are all things that really can make a difference in patients' lives. I've had clients who have gotten on some of these medications who thought they might have to stop working, and once they started these medications, they were able to stay in the workforce. So these are huge. Sometimes antidepressants can help. We mentioned earlier how depression can add to fatigue. We also talked a bit about spasticity, and baclofen can be prescribed for that, so that's a wonderful solution there. So there are things that can be done prescription-wise that can really help patients.
Good to know. And other than medications, what else can patients do to control fatigue?
Well, just like stress, we have to pay attention to what brings on our fatigue. So if you know what your fatigue triggers are, you'll better be able to prepare for it and maybe even to pace yourself throughout the day. So again, I like people to try to assign a fatigue level to each of their activities in the day. You'd want to sort of do a rating from 1 to 10, kind of the way you would rate maybe pain. So 1 would be, it's not too taxing, and 10 would be pretty high on the scale. And there are several different things you might want to include in there, like socializing, exercising, shopping, traveling, driving. Assign each one of these things sort of a number so that you can kind of pinpoint, oh, this really, does make me tired, and I need to do this earlier in the day, or I need to pass this chore off to somebody else in my family. Maybe you wind up, with work saying, I can work, but I need to work half a day, or I need to go to part-time, that sort of thing.
So making the connection between activities and fatigue level gives the patient a sense that they can manage their energy.
Absolutely.
Okay, we talked a little bit about napping earlier, but does that really help?
You just can't underestimate the value of napping. I'm not kidding. I'm a real advocate for this, and it doesn't work necessarily for everybody, but keep in mind in other countries they all take siestas, and it's a part of their daily life. And